Good evening to you. A hospice providing care for hundreds of people across West Sussex says it's facing a surge in patients needing end-of-life care due to delayed diagnosis caused by COVID.
Staff at St Barnabas House in Worthing say the pressure and emotional burden is relentless. They've had to adapt their services and provide more beds to cope with demand. With more on this, here's Chloe Oliver.
Don't let the empty corridors fool you. Staff at St Barnabas House Hospice in Worthing are busier than ever before, providing end-of-life care for people and support to families. The number of people in need of their specialist support has doubled as a result of the coronavirus. As we were filming, the head of clinical services, Ellie Hayter, told me today they've had 6 seriously ill people needing their help, but just 1 bed available.
I think it feels quite relentless. There's the physical demands of a job and working longer hours and extra shifts because the team are pulling together. But I think there's a huge emotional burden for looking after the numbers of people that we've been looking after that have been dying in a short period of time. But I think the reality is we're very busy at the moment and we haven't stopped. And I think the impact will hit staff as we slow down.
There's no signs of slowing down anytime soon. Staff have daily meetings with nearby hospitals. A big part of their work is care in the community. Staff are driving to visit more than 400 people in Sussex to offer end-of-life care at home with their families rather than in hospital. That's on top of the 20 inpatient beds at the hospice in Worthing. Those here face difficult days ahead, and so we respected their privacy. A patient who was happy to talk to us was Babs Huggins from Littlehampton. She's had a double mastectomy, needs a machine to help her breathe, as well as other health complications. She told me living alone during the pandemic pushed her to breaking point.
How much do you think the hospice here has changed your life, as it were?
They absolutely changed my life. The doctors here had the time to listen, to talk to me. I can't thank enough. They've given me back my life. And with this coronavirus, it is still going to be there when I go out there. But I feel a lot safer now. I feel I'm a much stronger person to fight.
As a charity, all of the services here are free. Government grants cover 24% of their costs, but the rest is reliant on fundraising.
We've had to completely adapt the way that we fundraise. It costs around £9 million a year to run St Barnabas, and we've lost over £1 million through having our shops closed, through having events cancelled. So it's been a real challenge, and I think it's really difficult for us knowing that the income is a struggle, but actually the community now need us more than they've ever needed us before.
The dent in their budget comes at a time when every penny is helping fund the surge in demand. A hospice which, now more than ever, prides itself on maintaining a sanctuary of calm for its patients, away from the uncertainty beyond its doors. Chloe Oliver, ITV News, Worthing.